Yes, you like, chain me to them. Hello, everybody, and thanks for joining our webinar today from the Alliance for Retired Americans. I'm Rich Fiesta, the Executive Director, and on behalf of all of us at the Alliance here in Washington at our headquarters, and those of you who are activists around the country who have joined with us today, we want to say thank you for being with us. We need all of us to be active, educated, and mobilized, because just in the last few weeks, we have seen Medicare come under attack in very, very serious ways. So today, this is what we want to do. We want to bring everybody up to speed as best as we know it on what's up with Medicare, and also Medicare along with Medicaid, the Affordable Care Act, and how all that relates to seniors. And then we want to tell you about what we're doing with our activism around the country, because we just can't sit back and let a program where finished celebrating its 50th anniversary last year come with us as well. So I'll be joined by our field director, Brendan Kelly, in this presentation. But first, we want to let you know the current state of affairs and what is up. You've probably heard of this guy named Paul Ryan. And just the other day, Paul Ryan, right after the election, said Medicare has got some serious problems because of Obamacare. Those things are part of our plan to replace Obamacare. Well, that's just false, because actually Medicare has gotten better in its finances over the last few years. And as we remember, Paul Ryan, for the last 6 years, has been trying to privatize Medicare, turn it into a voucher program. President-elect Trump, shortly after that, has nominated Georgia Congressman Tom Price to be the Secretary of Health and Human Services, which oversees the Medicare program. And barely a week after the election, Representative Price said that, as you can see here, he expects to move on Medicare reform 6 to 8 months into the Trump administration. So that's next summer. So you can see why we're very concerned about what's happening. And this is what they've proposed, and this is what they've been voting on. And we've been lucky the last few years to have the veto pen and Harry Reid leading the Senate, which we will no longer have in January. But the Ryan plan with Price is to first raise the age of eligibility even to get Medicare from 65 to 67. That means you'd have to work 2 more years to do that. And otherwise, if you have to work to 67, that means you'd have to somehow go out and find insurance on your own. You wouldn't have the guarantees of Medicare. They would voucherize it. Let me tell you what that means. You would get a set amount of money, and rather than going to one-stop shopping that Medicare has been since 1965, you would then have to go and basically fight with insurance companies that may or may not offer a plan in your area or state that could change it every year. And the amount of your voucher would be less in real dollars every year. Now, if we could go back to the previous slide, I want to make a couple other points. They would limit Medigap coverage, that folks who are on traditional Medicare often need Medigap coverage to supplement it. That would be limited on what it covers, and would also over time shift cost to beneficiaries. In other words, you and every other Medicare beneficiary would be paying more and more each year out of pocket, from your pocket, into a plan that would be run by insurance companies now. So let's look at what else this other plan has to be. They're also talking about cutting Medicaid. Now, Medicaid also came into being with Medicare in 1965, and it covers lower income people regardless of age. It's a joint federal-state program, and state budgets are very much dependent on how much Medicaid comes into their state through the federal share. What we know now is that most long-term care, nursing home care in the United States, is covered by Medicaid. So Medicaid spending, 62% of it, 3 out of every $5 of all long-term care comes out of Medicaid. And the most common Medicaid recipient is a single elderly woman who's living in a long-term care facility, a nursing home. That's how important Medicaid is to older Americans as well. Also, we see talk of replacing the Affordable Care Act, or first repealing it, and we don't know what replace. The Affordable Care Act did some great things for older Americans in Medicare. the drug discounts that are available under the Affordable Care Act would be gone. Since the Affordable Care Act came into being, we now have free wellness visits every year, no co-pays or deductibles for preventive coverage for mammograms, prostate exams, diabetes screenings, bone density screenings. All those now, thanks to the Affordable Care Act, have no copay or deductible. Very, very important protections in trying to catch disease early before it can cost much and hurt the beneficiary. Pre-existing conditions. Sometimes people retire or need insurance coverage before they're Medicare eligible. So for older workers and early pre-Medicare retirees, having that prohibition that insurance companies can stop giving you health care because of a pre-existing condition, that would go away too. So those are some very important things that the Affordable Care Act hurts older Americans, along with Medicaid and Medicare. So those are kind of the important things we've been doing over the last few weeks of trying to figure out how what this would do in terms of immediate impact on seniors. And as you can see that Price and Ryan, and who knows in this new administration, may be for it as well. Now here's our challenge. We know, because we're activists, what this will do. But a poll by the Pew Research Foundation, neutral poll, just came out the other day and said that most people are unaware of these proposed Medicare changes. And the thing is, when they find out about it, once it's explained to them, 2/3 oppose it. However, if you don't hear anything and you just hear words like Medicare needs to be modernized or Medicare needs to be up to date or something like that, people favor it. But once the terms of Medicare voucherization, privatization happens, raising the age are explained to a voter, to a citizen, then people overwhelmingly oppose it. So that's why we are here today having this webinar, not only to activate ourselves, but to activate our friends, our neighbors, our families, future retirees as well on these very dangerous proposals that we're facing right away. So we're not just being active about it, we're out doing things. And we've already been to press conferences with members. We're making arrangements to go meet with House and Senate leaders and our local senators and congressmen. And here to explain how our activism is the Alliance Field Mobilization Director, Brendan Kelly.
Thanks, Rich, and thank you everyone for getting on this presentation today. As Rich mentioned, we have been doing some events already to mobilize around pushing back against the potential cuts and undoing of Medicare. On the previous slide was some pictures of a press conference last week here in Washington on the Hill with Leader Nancy Pelosi, Leader Chuck Schumer, as well as with Bernie Sanders and with others. That's during that press conference, we delivered over 1 million signatures to lawmakers, people like you who signed petition telling them to get their hands off our Medicare. Of the 1 million signatures dropped off with other groups, over 250,000 of those were signed by Alliance members. We've also had member meetings. We have some pictures of a meeting in Dallas where people are showing their Medicare selfie cards. These are cards that people have an opportunity to write in the number of years that they've worked to pay into Medicare and inform people to keep their hands off their Medicare. This is part of a toolkit that we're circulating to members, and everyone on the call would like to make sure that you have access to that toolkit as well. Looking at the timeline ahead, you'll see that last week's press conference was the kickoff. Starting last week as well and continuing through the end of the year, Alliance members and our allies are scheduling over 100 lobby visits in district, in state, to members of the House and the Senate. Many of them are allies in preserving Medicare, but many of them people who have publicly stated that they would like to see it privatized, reduced, or undone. Part of the reason why is that, as Rich showed with the Pew polling, is that this Medicare is an absolutely popular program. When people find out that there are people who want to cut it, that is very unpopular, and so it's important for us to talk to people about why it's important to us. And so going to members of Congress who are in favor of reducing Medicare is a priority for us. And then moving further ahead, we're planning 2 national call days. The first will be on Wednesday, January 4th, calling Congress, telling them to take their hands off of our Medicare. That's the second day of work for the 115th Congress. And then the second national call day will be on Monday, January 23rd, and that will be to the White House, and that will be on the first day of the president-elect's day in office. So there are a couple of ways that you can get involved, and it all starts at part of our website, retiredAmericans.org/actions. At that site, you can sign up to pledge to visit your senator or your member of Congress before January 1st. Should you sign up, we'll get in contact with you and provide you with our lobby packet that includes a lot of the policy points that Rich outlined today, as well as some best practices for your lobby visit, as well as a report back tool where you can record the things that happen in your lobby visit so that we can build a national lobby intelligence database. There are other things in your toolkit, such as the selfie sheet, where you can write how many years you've worked towards Medicare, and then you can share your story. The Alliance also launched this part of our website where Alliance members are telling their story and talking about what Medicare means to them. You can you can submit your story at the same place, retiredAmericans.org/actions, and then you can view this website at retiredAmericans.org/Medicare-stories. But again, encourage everyone to visit our action portion of the website, retiredAmericans.org/action, because it's really important for us to put a face onto a Medicare and what it means to all of us. These are just the beginning points of a long campaign that we're hoping to have that will build upon the lobby visits, build upon the days of action, and build upon presentations like this. We really would like everyone to be a part of it and to be organizers and activists with us. And so I strongly encourage everyone after this presentation to visit retiredAmericans.org/actions and sign up. And I think that at this point, we're going to open the floor up to questions. As you can see, there is a link at the top of this slideshow where you can type in the questions, and then we'll put them on the screen and then answer them. Also, if you're watching this on YouTube, if you scroll down to the description part of the video, you'll find the link there, and you can click on it to bring you to the page where you can enter, where you can type in your question. And I think with that, being said, we have a first question from someone.
Hi, yes, thanks. And again, like Brendan said, if you want to type in and ask us a question, hit the link up at the top. We have a first question. I have high drug costs due to rheumatoid arthritis and fall into the donut hole. What will happen to me? Well, that's a very good question because right now we don't know. As you know, under the Affordable Care Act, the donut hole, which we opposed way back in 2003, is going to close by 2020 because of the Affordable Care Act. So no longer will people have to pay premiums after they hit roughly $2,500 in costs and not get any benefits, pay for all those drugs out of pocket, and then wait till they get up to $4,500, $5,000 till they get coverage again. This is a very good question because we've not seen the language on how the Affordable Care Act repeal would look like, and then how it would interplay with this very important provision that we fought to get back in 2010 to close the donut hole. So that is a great thing to take to your local congressman and your local senator and say, I am a constituent. I don't work for drug companies. I need my drugs. I fall into the donut hole. Every year it's getting a little better. What's going to happen to me? So thank you for the question, but this is exactly the type of question we should be asking our elected officials. Okay. Next question. Another very good one. I am under 65. How will this affect me? Well, it could happen in two ways. One is if the Ryan Price bill becomes law, you're going to have to wait till 67, potentially, before you can become eligible for Medicare. And regardless if the Affordable Care Act is repealed, the protections that you have of getting guaranteed health care without paying an exorbitant price because you're older, and most people over 55 have some sort of pre-existing condition, arthritis or diabetes or on and on and on. Right now, you have protection and you can get insurance under the Affordable Care Act. So this is another good question to take to our elected officials on how it's going to affect you if you're under 65. It could be two ways. You may have to work longer to get onto Medicare and therefore need insurance protections and the ability to afford insurance. And that could be undermined too if the Affordable Care Act repealed. This is just another example of how the laws work in tandem, and pulling them out by the roots could cause a lot of problems to older workers and older Americans who are on Medicare. Again, thank you for that question. Next question. My wife is in a nursing home. Will we be affected? Well, that goes to the heart if she's receiving some of her care paid through Medicaid, that the Medicaid program could be what they call block granted to the states. In other words, the states would just be given a sum of money and their budgets would be cut that they could come up with, and the costs of nursing home care, long-term care, would then fall more and more back on the patient and the patient's family. This is another thing we're extremely concerned about as well, in addition to the Medicare issues that, as we mentioned, and we had the slide before, that Medicaid is a program where 62% of the dollars that it expends are expended on long-term care for older Americans. So again, another great question that we need to take to our elected officials and ask and say no. Thank you. Let's go to the next question. I've been getting my colonoscopy free of charge. Will I have to pay now? Well, if they repeal the parts of Medicare that gives those screenings free of charge if you're on Medicare, well, I guess the answer would be yes. We'd be back to paying copays and deductibles, which is what we were paying beforehand, before the Affordable Care Act was. Under Medicare, you'd be paying the pre-2010 copays and deductibles. But again, another great question that we have to ask our elected officials on what's going to happen. Let's go to another question. Oh, in fact, they're telling me that that was the last question. If there aren't any more, what we want to do again is first say thank you for your activism. Getting on here with the webinar on us shows that you're concerned about not only the future of Medicare and healthcare in this country, but the future of your families and what generations come behind us, the next generations of retirees. As I mentioned earlier, just a year ago, we celebrated the 50th anniversary of Medicare, that great law that went into effect in 1965. And we at the Alliance want to be here for the next 50 years and want to preserve and protect it. In fact, we actually want to expand it. As we know, Medicare doesn't carry insurance or cover insurance for dental, for hearing aids, for eyeglasses, that we still think there's unfinished work to do regarding Medicare, but we may find ourselves in a situation in the coming months of having to defend what we so far have fought for over the last 50 years, and just 5-6 years ago made even more improvements to. So we'd ask that, again, you get active, visit our website, www.retiredamericans.org, our Facebook page, get active, find if there's lobby visits to your local congressmen and senators in your state, get active with our state alliances, check back, sign up for our Friday alert, our Friday email where we tell you what's going on as well. And again, tell your friends, your neighbors, and your families. We've got to inform them the dangers that is facing Medicare just in the coming 6 to 8 weeks from now, and then into next spring and summer too. This is going to be a full frontal assault from the folks who are saying that they really want to enact their plans that we've been fighting for the last 5 or 6 years on privatizing and voucherizing Medicare, and then along with other programs, as we've talked about today, Medicaid, as well as the progress that was made for seniors under the Affordable Care Act. So we'd like to do these more in the future. We're going to be doing them more as the year comes on. Again, we'll have a call-in day on January 4th to Congress, and on January 23rd to the new president, saying don't cut our Medicare, and in the meantime, urge you to stay active and be active with the Alliance. Again, thank you very much for joining us today.